Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In this podcast, I want to talk about all the reasons why people do not start with care, why they don't start with the solution that is right in front of them. And I want to talk about this because we have the holidays coming up, and partially because it can be somewhat painful to know that you can help someone and then see that there are clear barriers in place for them starting. And so what I want to do is talk through those and kind of break them down. Now, why is this helpful conversation? It's helpful conversation because understanding the solution is one key to the puzzle, but having the right motivation and understanding of what it takes to get there is almost like a bigger problem itself. Now, because we're a solution-based practice as opposed to a symptom management-based practice, we have to be very good at breaking down those barriers and understanding how to motivate people so that they can get where they want to be. And when you know you can help someone get from point A to point B, but the barrier is maybe a perception of what they think is reality, or a perception of what they think is involved, or maybe a lack of trust, whatever it may be, we need to do whatever we can in order to build trust, break down those barriers, not for for our own sake, but for the sake of the individual that we're talking to, of this person that needs relief. And it's basically a few months away, but we need to just start the process, and there's some barriers in place. And so I want to talk about those barriers, how to overcome them, why we should think differently, kind of reframe our thought process. Now, if you're new to this podcast, welcome. I'm Dr. Taves, the host, and I'm the owner of Novera Headache Center. We have locations out here in Colorado Springs, and Parker. We have people that fly in from out of state all the time that are seeking treatment. We obviously have people locally that come to see us in person. Then we have virtual coaching. And so we have avenues for you to get started. So we're going to talk about all the different barriers that people have, how to break them down, why we should think differently. And it's important that anyone listening to this, especially if you're hesitant to start or trying to understand like what is actually involved in helping myself and getting to the solution, more of a solution-based approach, this is going to be an important podcast topic. With the holidays coming up, it's extra important that we get through any of the barriers that might be there, because I want you guys feeling better and healthy and not having a headache or migraine interrupt your Thanksgiving or your Christmas. By the time this comes out, Thanksgiving, I think, would have already happened. So let's look into Christmas, into the new year, and understand that even though life's busy, even though we have holidays coming up, even though we're hosting, even though we're out of our rhythm, there are still things that we can do and decisions that we can make that if we understand the value of where we're going towards, then we can actually make the lifestyle changes that need to be made. Okay, so first off, I'm going to go through a list of the common things that we hear of why people wouldn't start to make the changes that they need to make in their life. So the biggest one, or one of the biggest ones, is you're waiting for the next medication to kick in. So maybe you've just recently started a new medication, or you know that there's a medication that's kind of like around the corner, but hasn't been prescribed yet, and you're hopeful that will be your solution. Okay, now I want to hit on this. It really has to do with, are we trying to solve the problem with a solution that really doesn't make any sense? Now, if we take the framework of our Western medicine model and we say, okay, headaches and migraines are a spontaneous neurological event. So a migraine would be described as that, a spontaneous neurological event. They classify and diagnose migraine based on a series of symptoms. So one-sided pounding, throbbing sensation, accompanied by light sensitivity, sound sensitivity, nausea, maybe a visual disturbance, things like that. So if you have those symptoms, you're likely to get the diagnosis of migraine, especially if it's really debilitating. And then they would describe it as, well, they'd say, we don't know the actual cause, but it's a spontaneous neurological event, which basically means your solution is going to be medication. Medication that manipulates serotonin levels, CGRP, this protein that transmits pain signals. So basically any medication that's going to shut off or change the way you experience pain is the quote unquote solution that's provided, which is really not a solution at all. It's just masking an alarm signal that needs to be paid attention to, and we need to understand the underlying problem. Okay, so if you're waiting for the next medication to kick in, that's okay. But you kind of have to understand that framework or that mindset is not a solution-based mindset. It's really it's a Band-Aid, right? So it's a symptom management-based mindset. And so if you want that approach, if you just want to take the pill or the injection or the thing that quote unquote is less disruptive to your life, and you're okay with it being largely or exclusively symptom management, then that's a route that you can go. But if we're asking the question and we really want to find a solution-based approach, then waiting for the next medication really doesn't make much sense in this scenario. And so you need to ask yourself, what am I really wanting? Am I wanting to improve my health by understanding what the actual problem is and move forward towards a solution that improves my situation, puts me back in the driver's seat? I'm not just waiting for the next migraine to hit, and then fortunately I have a medication that works, and so I'm just taking my rizatriptan, sumatriptan, I'm taking my Nurtec whenever I feel it hit, but I'm actually understanding this and solving it from the root. You have to ask yourself, like, which category are you in? And then we are in the business of solution-based treatments, and so if you're in that category, then yeah, of course we want to work with you. Okay, the time isn't great at the moment. So this is another big one. And it's something that oftentimes can be a little puzzling, but I do want to empathize with our patients and the people that we hear this from. Now, I want everyone listening to this to evaluate the impact that headaches or migraines are having on your life. And it can be a challenging thing. But what we commonly hear is that people are desperate, they're at their wits' end, it's disruptive to the point of they're missing days at work. Especially it's impacting their social life. And so they have challenges when it comes to functioning in a certain level. Maybe they're able to function at work and their social life, but they just get home in the evening and they're just done. Like they're exhausted. They have to go to bed early. And they're, in a sense, like not having to change their life, but it is having an impact on the quality of their life because they're just sort of drained. Maybe it's brain fog in the background because you just always have this nagging constant level of tension or pain. And then maybe it's more direct. Maybe you're like, yeah, I get 2 migraines a week and I basically have to call off at least 3 or 4 days out of the month. Like there's real monetary value there. There's dollars that you're not able to earn because of your migraines, and then you can attach the value there. But essentially what I want you to do is do this exercise of understanding the impact of these migraines on your life. Now, if I was asking you to do that and I didn't have a real solution, then it would probably be just like, I don't know, kind of a cruel game to play with yourself of like, oh yeah, now I know how much this is actually impacting me. But when we have a real solution, then we use that impact, and the whole point is to like not sugarcoat it, but like really value, like, okay, what would I do to get out of this situation? We did a post polling people on, okay, if you could, pay for a kitchen renovation or, have a successful treatment for your migraines, like which would you choose? And like 95% of people chose the migraine treatment. And so what we're doing with that question is framing like, how valuable is this? Because lots and lots of people will, spend $50,000, $60,000, $70,000 on kitchen renovations. But when it comes to their migraine treatment, will, in a sense, now a lot of people have spent that much money, but the idea is the value, if you think about it, is above that, kitchen remodel. Whatever people had in their mind is what a kitchen remodel would cost or the value of it. I mean, I've been through one myself, and yeah, it's very expensive. We did it as affordably as we could, and I think it was like 30 grand, and that was a lot of DIY. And but anyway, the point is, there's probably a ton of value there, and so we want to answer this question of like, this isn't great at the moment. It's not a great time. Maybe it's because coming into the appointments or fitting in exercises to my day. We have to ask ourselves, do we want to be proactive or reactive? Okay. So when we understand the cost that's associated with continuing in the current state that we are, and then we ask ourselves, do we want to choose when we are giving up our time to manage this headache or migraine, or do we want to react to when the pain gets high enough that we don't have an option and we just need to be in bed and can't operate that day? Now, again, it sounds like an obvious, like, well, obviously we'd like to be proactive and choose when we sacrifice our time, but this is something that people struggle with. They feel like they're at capacity. They don't have the option to fit something else into their life, when really, when we reframe it, the migraines are stealing hours, if not days, on a weekly basis from you. You're just reacting to it. And so the time is there, and it's there because it's forced to be there. But what if we start shifting that and we proactively implement things that are going to help, so that when we see you start getting control over your life again, you actually have more time, and your capacity becomes greater because you have higher energy levels. You're not dealing with brain fog. You're more productive. And now you have your evenings available because you're not just drained at the end of the day. Another one is you're still understanding your triggers. So oftentimes people will confuse triggers for the actual source of pain. Now, we have seen virtually every type of headache and migraine and every type of trigger. Like, I can almost guarantee you that if you come to us and you're like, well, my trigger is, like aged cheese from, a certain village in France. Like, I don't know what it is, but like whether it's food related, barometric pressure related, hormone related, stress related, physical activity related, there's all different categories of triggers. And essentially what we're working with here is your body's threshold, the environment you experience pain in. Pain is not experienced in a silo, meaning the state of your health and your body and your brain when your pain signal is being sent, all of that matters. And so there's different things that impact your threshold. And so when we're trying to evaluate, okay, like, well, since I don't have a physical trigger, it's probably not my neck, or mine's hormone related, and so I'm trying to explore hormones. Now, that's not inherently wrong, but without a doubt, we need to understand where the pain is coming from, and it is almost always going to be neck, jaw, and shoulder related. When I say almost always, it's sort of like I dare you to call us and try to prove us wrong, because it really doesn't happen that often. We have a very high success rate, and we give away a free half hour to start, which is something that you should take advantage of, because I'm not sure if it's going to be there forever. And so if you've waited and you're like, I'm not sure if I want to do this or not, like, give us a call, book the free half hour, because we have very likely helped someone like you, and you don't have to wait to understand your triggers better. Going through a process will actually help you discern how to think through your triggers, whether to avoid them or if it's just something that is more connected to the neck. And once we get the neck calmed down, like, it won't even be a trigger, things like that. Your headaches are slightly different. Like I said, we've seen nearly every type of headache or migraine and had success with nearly every type of headache or migraine. So there's really not a scenario that's like, oh yeah, we can't help that. There's varying degrees of involvement with, and it depends on the type of headache or migraine, but almost always, if we have a motivated patient that's willing to stick with our process, like the outcomes are very, very good. Like 80-90% of people will find the relief they're looking for. And if it's not that, if you're like the 10 to 20%, it's not necessarily because like, oh, this failed. It's because like, oh, we had a significant airway issue, or we have to get their, on the systemic side, like we have to get their health, their gut health specifically in good shape because their threshold's so low. Like, we understand what the problem is past us, and then we do that next step. Okay, what if I'm not capable of sticking with it? This is another one. because we're solution-based, we have to kind of elevate the level of work involved, or the level of commitment that's involved. And again, because it directly impacts your success in this process. And we don't want to sugarcoat what we're selling, or what you need to get better, because that doesn't really help anyone. It would kind of be like, and I use the dental analogy all the time, so it probably gets old, but like, it'd be like a dentist saying like, oh yeah, I can cure your cavities and you never have to brush your teeth again, and blah, blah, blah. Like, the easier a thing is, we should be more and more skeptical of it. But when something feels like it's just, oh, you're just telling me to move towards healthy habits, we can trust that when the level of work involved is elevated to an extent. And then with this question, what if I'm not capable of sticking with it? I would go back and reevaluate the value or the cost involved with sticking with your current state. Like, if nothing changes, are you okay paying the price of the headache or migraine indefinitely, or however long your headaches, which usually it's like, 60s, 70s when it'll like die down. But are you okay sticking with your current state for that long? And if not, what's the value in that? Like, what's the cost involved? And then when you think about, okay, how do I implement healthy habits? You need to use that as motivation to say, okay, like, I actually can, and I need to make the time to make these changes. Another one is my doctor doesn't think it's a neck problem. It's just asking the wrong question. So when it comes to a primary care doc, a neurologist, they are not neck specialists. They're not trained to evaluate and understand the biomechanics of the neck and the association with the neck and the head, or these head or facial pain symptoms. And so I understand that our healthcare system is really puts the MD in the driver's seat in like pretty much every health decision. And so it's natural for people to hold their doctor's opinion with a ton of weight. But because if your doctor, and we hear this all the time, if your doctor is like, oh yeah, if you have neck pain, it's basically a symptom of the migraine, but it's not causing the migraine. Like, it drives me nuts the number of times we hear that. Just know, like, all the people that have been told that are the people that are like getting better. Okay. And if we think about, okay, like, what's the risk in treating my neck? You might have some soreness, but if you think of the traditional Western medicine model of pharmaceuticals, one, it's not solution-based, and two, like, there's tons of side effects, and the impact on your long-term health is significant. And so, like, the risk reward in these two options, it doesn't make sense to me to diminish or dismiss is a better word, dismiss the avenue of like, let's continue to pursue your neck because there is a well-documented connection between head and facial pain and the neck. Like, it doesn't make sense to me. So if your doctor doesn't think it's a neck problem, like, that, you're in good company with just about everyone else with migraines in the world, and we help them all day, every day. Okay. So that's okay. Headaches just started a few months ago. So if you're just new on this path of headaches and migraines, like, that's great. We want to help you because we see people that have been dealing with this for decades. So don't let that be a barrier. Like, let's start now. And then, a timely one is headaches or holidays are around the corner. I have travel coming up. There's something that I'm waiting for, and then I'll start. First off, within weeks, like within a couple weeks, a good percentage of our patients. So on average, within 6 visits, which is 3 weeks, people are reporting 50% improvement. And oftentimes people will even walk out of the first visit feeling some relief. Okay. It's not everyone, but there's definitely a large percentage of patients that very quickly can find relief. The other thing is, with our virtual coaching program, implementing healthy habits. Like, for example, I had a gentleman who flew in from Poland, and I basically had a phone call with him, 10-minute conversation, and he was getting morning headaches, and he said he was sleeping on his stomach. I said, stop sleeping on your stomach, and I made some recommendations, and it reduced his headaches by 50%. Okay, 10-minute conversation, reduced his headaches by 50%. Now, the leading medication on the market, these CGRP drugs, report to reduce symptoms by 50% in half the people that take them. Okay, So I basically did that with a 10-minute phone call with someone that was in Poland. So what I want you to understand is that there are changes that can be made right now, that not everyone is going to see that quick of an impact, okay? But we need, like, today is the day to start, and we need to get out of our own way with sort of the, well, what about this? What about this? I have vacation, I have travel coming up, because we help people navigate those things all the time, and we want your holidays to look much better than they could with it being interrupted with a migraine. And if we made a few suggestions, there's a higher chance of your holidays going better. So anyway, don't let that be a reason we don't start. Okay, so the thing that I want to go back to is you have to evaluate the cost of not changing, and then you have to look at what the value is of making the changes in your life so that you can start living without headaches or migraines. And the reason I say that you have to evaluate the cost, use that as motivation, is because our process is not swallowing a pill, right? It's lifestyle changes. It's things like improving the way you sleep, implementing movement throughout the day, specific exercises, coming in for appointments. Like, we need your time. But the thing is, over the course of a 3-month period, most people are going to find the relief they're looking for. And with those patients, it's a small price to pay for the benefit that they're getting. And so we want that to be you. The bottom line is we're looking for people that find that are willing to put the work in to find the relief that they know is there. They still have some sense of hope. Well, let me take that back. Actually, a lot of people we work with are sort of like potentially hopeless. They're desperate. They feel like, okay, I don't know what to do, so I'm just going to try this. Which, again, like, just starting, if you're there, like, I get it. Our healthcare system can beat you up pretty good. And so we want to take bite size. Like, if we're trying to overcome what seems like a mountain, we want to take it one step at a time. It's a better analogy. And so just starting is a good place to begin, obviously. Okay. When we think of how we make decisions in life, and if we're going to frame like how we should evaluate if something's going to add value or if something's not going to add value, of course, we want things that are quick and easy, right? Like, our whole life is built around making it quicker and easier. So whether that's with the iPhone, with cooking appliances, kitchen appliances, our vehicles that we drive, the type of work we do, everything is sort of going to this quicker, easier, right? And what's interesting is that when we make our lives quicker and easier, we oftentimes see the detrimental impact of that. So whether that's with like we have these cell phones that make our life so much easier, but then they're like sucking our brains because we're on social media all the time. Or maybe it's like we are looking for a gig economy, right? So like whether we Uber or DoorDash, and there's nothing wrong with doing those things, but maybe there's less accountability, and so we do those things, but oftentimes we need more accountability. We need people in our lives to like a boss to tell us, okay, like, we need to shape up. So quicker and easier isn't always better for us. And so when we think about solutions, and especially when it comes to healthcare, we need to apply that as well. Think of our dental health. We can, the saying is like, you don't have to brush and floss your teeth every day. You just have to do it with the teeth that you want to keep, right? And so the reason that we brush and floss is because we don't want like dentures. Now dentures are out there, and you can just you can go today and have all your teeth pulled and get dentures and never have to worry about brushing or flossing again. Actually, I'm not 100% sure if that's true. Maybe you have to clean your dentures I don't know if you brush them. Anyway, my point is that there are quick solutions, but there's a reason that people don't do them, because it's better to put the work in every day to keep what's naturally there. Losing weight. I think people should naturally be skeptical of a weight loss pill. Now, we did a podcast on the Ozempic and the different weight loss drugs that are out there. And so there is like essentially a pill. It's not necessarily a pill, but there is a way to lose weight that's become very easy. And we talked about some of the risks involved, but essentially we should be more skeptical naturally of the get or the lose weight quick option, as opposed to just the tried and true, like let's exercise, let's figure out a way to change our diet, reduce our caloric intake, okay? Because we know those things are real and valuable. Building wealth. We know that there's all sorts of things that will claim to be get rich quick, right? But when you look at the tried and true ways to invest our money, it would be, take Warren Buffett's advice, and the stock market is a place for money to move from the impatient to the patient. So patient people that, save over time usually get where they want to go. Think of the tortoise and the hare, right? It's one of my favorite stories. And the thing that needs to sink in is that the tortoise wins the race, right? Like the tortoise wins the race. I feel like we read that story and it's like, oh, this is a cute children's book that, tells a tale of a rabbit who is kind of distracted and then a tortoise that was steady. And yeah, but do we really believe that the tortoise wins? Like the tortoise won, and the things that we should be skeptical of are the ones that are quick and fast and easy. And so the problem is like it's a harder sell. It's a harder product. But if we can understand the value and like, okay, yes, this is where I need to move because it's solution-based rather than just masking my symptoms, then we can truly find the relief that we're searching for. And so the longer I do this, the more proud I get of like leaning into the challenges in our product, meaning the time, the amount of effort that's involved, like the lifestyle changes that need to be there. And as I'm talking, you're probably thinking like, man, there's like so much that I probably need to do going through this process. It's really not as much as you think. We try to implement changes into every element of your day, meaning like going from sitting to standing or changing sleep position or implementing, these exercises morning and evening. And then we try to get to a point where it's like brushing and flossing. And then like we don't consume Coke and a bunch of sugary treats throughout the day. I guess we might, but in a sense, we know that that's impacting our dental health. And so when we know that, we're not going to be surprised when we have a bunch of cavities if we've made those decisions. So the same type of idea, like we want to educate ourselves so that we can make better decisions. But it's not like, oh, I have to quit my job in order to not have headaches. We haven't run into that situation yet. And so, but I do want to emphasize that we want time to be on our side, so we have to be patient and we have to implement the healthy habits, and then we have to understand the cost of not changing so that it motivates us to make the changes in our lives. Now, if you're new to this podcast and you're just listening to this, or maybe you've listened to it for a while, the things that we talk about on this podcast, just do them, implement them, whether they feel simplistic or like, oh, my situation doesn't apply, or you have one of these barriers, just start. And especially if you're like, hey, I'm to the point where like I'm at my wit's end, or maybe you're not at your wit's end, maybe they're early on, but you don't want to live your life this way. You want to find a solution, reach out to us, and we would love to help you. Like I said, we have virtual coaching, and then of course in person, and we have people travel out all the time. We can have a virtual consult and figure out if that makes sense for you. And we would love to help you, especially with Christmas and New Year's coming up. Let's finish the year strong and on the right path and infusing some hope into your situation. Thank you all so much for listening to the Headache Doctor podcast, where as always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.